We are live.
Hi, everyone. Thank you for joining today. Alexandra here with a familiar face, Dr. Cleo Amelia. She is an acupuncturist, Chinese medicine doctor, herbalist, microneedling specialist out of Palm Desert, California. She's done other events with us, and I'm sure you've seen her on our social media. We're so happy to have her here today. And we're talking about expert ways to cool down hot flashes. Thank you so much, Cleo, for being here.
Yeah, thank you for having me.
Our pleasure. Feel free to ask questions in the comments, guys. We will have a little free giveaway at the end of the event. As many of you are probably thinking, well, hot flashes are related to menopause and hormones, of course. So that's why I'm so glad Dr. Cleo is here. I will have more things to say about the skin, but I'm going to let her kind of take it from here and lead the way in this conversation. Please do ask questions in the chat. I will be watching.
Okay, awesome. As Alex said, I'm an acupuncturist, I'm a Chinese medicine practitioner, and I also practice functional medicine. So I thought it would be fun to talk about both the functional medicine side of things and the Chinese medicine side of hot flashes. So first thing I want to say is that, we've normalized menopause symptoms like hot flashes, night sweats, mood swings, much like our culture has normalized PMS symptoms, cramping, irritability, whatnot. When, in reality, these are things that our body is trying to tell us that something is out of balance. It's not normal to have symptoms of menopause, and it's not normal to have bad negative symptoms of your period. You're supposed to just kind of get these things and then move on. So from a functional medicine standpoint, I always like to start with testing. So there's many different tests that we can do. Obviously, when you think of something like hormones, menopause and cycles, you want to do a hormone test. I like to use the Dutch test. It's a dried urine and saliva test. So that's a really good way to kind of capture a person's hormones throughout the day versus a blood test is just one quick snapshot. So that's a little bit more accurate than doing the blood test. That's why I like to do the urine and the saliva. And then obviously looking at very basic things like your blood counts, your red blood cells, your white blood cells, your immune function, how well your liver and your kidney are functioning, your thyroid, which is a huge hormone, plays a huge role in hormones as well. And then also a big one too, which I'll go into a little bit later, is blood sugar. So a lot of times women, as they age and get into menopause, can have a little bit of blood sugar dysregulation, and that can actually lead to hot flashes. And then obviously always looking at gut health, like are you going to the bathroom? Do you have any sort of parasite infection, bacteria overgrowth, things like that? And then making sure that detox pathways are open so that your liver is getting rid of things. Do you have an overabundance of heavy metals in the body? Were you exposed to mold? Are you sweating properly? Like, are you able to release the heat out from the body so you're not just overheating? So I always like to start there with the testing. And then there are some common symptoms with different hormone imbalances, and I'm not going to go through each one, but you could have low estrogen, you could have excess estrogen, you could have low progesterone, you could have high testosterone, any of these mixture of things, and all can relate to hot flashes. So it's really important to kind of figure out where the hormonal imbalance is rather than just guessing like, oh, I have hot flashes, I must have low estrogen or something like that, because it definitely can be any sort of mixture of hormone imbalance. And then back to the blood sugar thing. So diet is always very important. I always like to start there, before supplementing with vitamins and minerals and even hormone replacement therapy. Like, let's make sure that you're eating properly. I always recommend this one book to my patients. It's called Glucose Revolution. On Instagram, her name, I think, is Glucose Goddess. So it's a great book. It's very easy to read, easy to understand, and it has a lot of hacks, you could call them, that you can implement into your everyday life to help balance blood sugar. everything from like taking a walk after your meals, trying apple cider vinegar before your meals to help with the blood sugar spike, weight training, things like that. So she has like, I think it's like 10 chapters that really outlines like each one of these things. And it's just very easy for people to implement. No crazy drastic diet changes or anything like that. And then often too, going hand in hand with blood sugar dysregulation, I see most women just not consuming enough protein throughout the day. And that number will look different for everybody. So I don't really like to throw out, you know, this is the number of grams of protein you should be eating per day. So definitely working with a healthcare provider to determine, you know, what your needs are and making sure that you are getting adequate amounts of protein, especially as we age, to preserve hormones, bone health, and it will help with blood sugar dysregulation. Obviously avoiding processed foods, refined sugars, and just having an appropriate amount of carbohydrates and fruit. So obviously not eliminating them altogether. There's health benefits to them, but just not over consuming any one thing. I also have people not eat too close to bedtime. You know, sometimes you may notice if you eat a big meal before bed, you're hot. So that can contribute to the hot flashes at nighttime or even into night sweats. And then just having a good window of time between dinner and your breakfast. So you're not eating right before you lay down to go to bed, and you're not eating the moment that you wake up in the morning. So having a good balanced 3 meals a day, trying to avoid snacking so you can give your body a little bit of a moment to rest and digest before you go into that next meal. And then next, because everybody asks about this, is supplements. So again, generally, I don't like to throw names of supplements out there because why you're having hot flashes is going to be different than, you know, why your best friend is having hot flashes and so on and so forth. So I wouldn't just go, you know, grab a supplement because you heard it was good for hot flashes or because you see it being thrown around on the internet. Definitely work with your healthcare provider to find out your root cause of why you're having hot flashes. That being said, there are a couple that are commonly thrown around on the internet, so I just wanted to address those. Hesperidin is one that is good for hot flashes. You might see that one a lot. Tribulus, that improves like lack of libido. It also improves high blood sugar and high cholesterol. So overall, it can help with metabolic function. Chaste tree, so a lot of people use that chaste tree berry to help with hot flashes and any hormonal changes, whether it's PMS or transitioning into menopause. Maca root is one that I really love for low sex drive, and it's really natural. It's just, you know, the maca root, that's it, and it's great for overall balancing of hormones. And then obviously some more common ones that you wouldn't necessarily think of for hormones but are helpful are digestive enzymes and probiotics, just again to ensure that your gut is functioning properly. Magnesium is great at nighttime to help with sleep, energy production during the day, and can also help with any constipation. And another one I love is L-theanine if you have any sort of blood pressure issues. So it's a natural way to lower your blood pressure. It's actually the main component in green tea. So that one's a good one before bed. It just helps kind of shut down cortisol, shut down that stress hormone, lower your blood pressure, and it may help then with your hot flashes at nighttime or night sweats as you're sleeping. But again, don't just go grabbing anything. It's always good to get on like a good regimen that works for you and your body.
Cleo, I have a question.
Yeah, go ahead.
Are you a fan of the Calm powder magnesium?
So that's a question I get quite often. I have a couple issues with it. So a lot of people take Calm because one, it's calming. All magnesium is going to be calming at nighttime, right? There's many forms of magnesium. No matter what form it is, it's usually going to have a calming effect at night. However, the type of magnesium that's in Calm helps with constipation, and it's known as a laxative. So it's not just helping with constipation, but it's a little bit too much of a push, and it can give people some loose stool, you can lose some of that kind of tone in the sphincters, and that help you go to the bathroom. So I don't necessarily like it because of that. And if you're forcing stool out, you're actually losing more magnesium, if that makes sense. So a lot of people are deficient in magnesium, but then if they take something that is more on the laxative side, they're losing more minerals, if that makes sense, which is sort of counterproductive of what you're trying to do when you're supplementing with anything.
Thank you. Yes, this is why a consult with someone like Cleo is so important, and not just looking on your own, because I feel like it is the most widely known.
Yeah, especially, you know, your grocery store. It's just right there. They have many different kinds and flavors, and it can be helpful for some, but in general, it's not my go-to.
Thank you. We have someone asking about exercises.
Sure.
Any types of physical exercise?
Can regimens that are more conducive to alleviating hot flashes. So again, this is going to really be based on where your hormone levels are at. Like Alex and I were talking a little bit about testosterone. And so if you're like low in testosterone, weightlifting would be really great for you to boost testosterone. However, if somebody has really high cortisol, which is your stress hormone, you may be putting extra stress on your body by weightlifting. So you really have to meet your body where it's at. You know, there's not a one size fits all exercise plan for people due to, you know, their hormone levels, their stress, and their inflammation. But generally speaking, you know, weightlifting is very good for women as they age because of the bone density and keeping muscle on, and also boosts up hormone production, but it isn't going to be for everybody. And then there was another question, was the significance of maintaining hydration levels and managing hot flashes? So that's a good one. I like that. I live in the desert, so I always talk to people about hydration. And people are so shocked when I tell them that, you know, the water that we drink, this filtered, clean water, obviously we have to drink filtered water, is really devoid of all minerals and all electrolytes because of the filtration process. So therefore, if you're just drinking this filtered water all day long, you're actually dehydrating yourself more because it's just running right through you. It has no way to be absorbed into the body. So I always tell people to add electrolytes and minerals into their water, and you can find them anywhere. Just make sure that they are low sugar, they don't have any weird chemicals in them or dyes. I like LMNT. It's salty, but I really like it. There's another one called Redmond's Relight that I really like. And then Whole Foods sells this like blue bottle. It's kind of like this big blue bottle that's trace minerals. Those are really good to drops just to add to your water. So definitely having adequate hydration and then minerals in your body can certainly help manage hot flashes. So good question. Okay, so if there's any other questions, obviously I'll answer them, but I'm going to get into the Chinese medicine side of things. So I do practice acupuncture and herbal medicine as well. It's sort of the same thing. Like, you definitely want to be finding the root cause of things. There's no one acupuncture protocol or one herbal formula that's going to help everybody with their hot flashes. It's based on why you're having the hot flashes. So a couple of Chinese medicine diagnosis kind of lingo that are attributed to hot flashes would be, one is blood deficiency. So basically you just don't have enough substance in the body to hold on to your heat, and it's sort of going out. Other signs of this would be dryness, blurry vision. Maybe you have a history of anemia. Maybe you get dizzy upon standing, very light menstrual bleeding opposed to super heavy menstrual bleeding. And then this would include things like herbs and acupuncture to help nourish the blood. Lamb is really good for nourishing the blood, red meat, beets, things like that. And then a big one too is digestion in Chinese medicine. So you just want to make sure that, you know, you're going to the bathroom, you're not constipated, because constipation can actually lead to hot flashes. So think about incorporating things in your diet like flaxseed. MCT oil is actually really good. So like a tablespoon of that in a smoothie or your coffee in the morning. Opting for cooked vegetables versus raw, because cooked vegetables are going to be easier to digest. And then more hydrating fruits like pears, for example, are very good at hydrating or moisturizing the digestive tract. And then there is another pattern that we see called heart and kidney not communicating. So this one's anxiety related. There's a mental health component to this one, where you're getting hot flashes due to, you're anxious. And this can happen during the day. If you have social anxiety, it can happen at night, when our minds tend to race and go on the hamster wheel. So this is where you'd want to include more things like meditation, having a good sleep hygiene, a good bedtime routine. And we tend to use heavier medicinals and herbs in Chinese medicine for this that are really settling of the mind, like anchoring of your shen, what we like to call it. And then the last one I'll discuss is your yang deficiency. This one is always kind of surprising to people because it's like, well, your yang is warmth. How am I yang deficient when I'm so hot all the time? But in Chinese medicine, we say that weak yang, like when you don't have enough in your body, it tends to rise. So it's not being nice and settled into the body where it should be, but it's coming out and you're getting a hot flash or you're getting night sweats. So this would include treatment-wise more things that are warming herbs, ginger, cinnamon, things like that. Using herbs with acupuncture, so burning them over the acupuncture points, using heating pads on the abdomen, or even soaking your feet in hot water. Again, eating more cooked, warm foods, soups, broths, and avoiding cold things. And we figure this all out together. So, a patient comes in, tells me what's going on. I ask them questions. And then based on your signs and your symptoms, I feel your pulse, and we come up with a diagnosis and we treat from there. So both acupuncture and herbs can be combined to treat menopause and hot flashes just based on, the root cause and fixing that.
Thank you so much. I was actually trying to find a Dr. Cleo in my area, and I think, is it the functional medicine website is the best way to find like a herbalist?
Yeah, I mean, a Chinese herbalist or a functional medicine practitioner?
I guess both. I mean, I wish I could find someone that does everything you do.
Yeah, I mean, a quick Google search might do it. You might have to do some digging, like search acupuncturists and herbalists and then see if they also do functional medicine. Functional medicine it's sort of a little bit difficult to explain, but I guess, okay, you can't just go to school for functional medicine. You have to be a doctor in order to practice it. So basically you can be a doctor of whatever you want. You could be a cardiologist, a OBGYN, a doctor of acupuncture, and that's a continuing education certification that you get after you've become a doctor as more of a specialized thing. So yeah.
That makes sense. My sister-in-law is a pediatrician and she has it.
Yeah.
But Cleo has so much information on her Instagram, guys. Definitely follow her. It's at Dr. Cleo Amelia, all one word, because a lot of the brands and things she talked about on here, they are on her feed, and she's always posting fun facts that we don't always know as skincare professionals, including myself. I'm happy to see questions about skincare in the comments, and we can definitely answer them. Hopefully you guys are still watching at Form and Functional Dental, asking about the perfect cream, because I definitely have one for you. It's the MDPen Revita Peptide Cream. Peptides in general are really helpful with menopause or perimenopause, as well as retinol. You want to do all you can to help stimulate collagen, as well as the treatments that we offer, such as microneedling and RF microneedling. Unfortunately, you lose collagen by about 30% in those first 5 years of menopause, which is unfortunate. But if you plan for it and you have the right skincare, you're doing the right treatments, you're doing the things Dr. Cleo talked about, you know, you can really get somewhere that way. After that, you're losing about 2% per year of your collagen. So it does luckily slow down after those first 5 years, but it can hit pretty hard. And I love that Cleo was saying how we've normalized this. It doesn't have to be, you know, a huge thing as big as it is, but I think that's, you know, a great point. Here's a direct link for that Revita Peptide Moisture Cream. More than anything, when it comes to hot flashes, I'm going to stress that you have our Copper HA Mist, this product here. And you can actually keep this in the fridge. This is going to keep it nice and cool, and use this throughout the day. This is our most popular product. It can be used as a toner, a setting spray for makeup. You can use it over your sunscreen. It's obviously for post-care. It's used during the time of treatment. I can't say enough good things about this, but for hot flashes, this one's going to be a must. You could probably even put it at your bedside if you feel like you need something, although it might wake you up in the middle of the night, something to use. If you're not already using a soap-free, dye-free cleanser, you absolutely need to. It's just going to make you more dry if you're not. So make sure you have MDPen's hydrating cleanser on board. Of course, as we age, our skin gets more thin, more dry, more mature. We're also more prone to sun damage, sunburn. So sunscreen is absolutely 100% vital. I will say, if you guys are still watching at Forum and Functional Dental Center, I would love to send you one of our Copper HA Mist. What you'll need to do is just write your contact email in the comments, or you can email us at mdpen@mdpen.co, and we'll make sure that you have this product sent to you. I'm going to keep scanning the comments here for any questions. And I know these are some of Dr. Cleo's favorite products as well. I definitely want to touch on acne too before I forget. We talk about hormones, and I've even seen patients in their, you know, 40s to 65 that never had acne their entire life, not as teenagers, not while pregnant, and then suddenly during menopause, you know, they have it. So you can't, with them, you don't really want to go straight into just drying the skin out like I guess we used to do for teenagers before we knew better. It was just a matter of like drying up the acne. You definitely don't want to do that with menopausal skin because it's already dry. So you definitely want to be on the right treatments, and then bringing in really light, safe exfoliants like lactic acid, or maybe a cleanser that has a little bit of salicylic, or a retinol like ours that still has ceramides and things like red algae for the microbiome of the skin. So you're not, you know, tearing it up. It's a different type of acne, and it's mostly something that you're going to have to cure from the inside. But at the same time, you should still be using healthy skincare. And these are some links if you do want to go shopping. Peptide link. Thank you so much, Cleo. Is there anything you want to add as far as skincare, moisture, hydration?
Yeah, oftentimes there's two things I would say are big, especially because I do a lot of microneedling on menopausal women or premenopausal women, and oftentimes I find that they have a hard time with cell turnover. So I've talked to you about this before, Alex, and I think two of the top things that I like to use are the Tighten and Lift and the retinol, just to help, you know, get a nice even redness with the microneedling treatments. So starting on those before they even begin their first microneedling treatment is helpful, and then continuing to use them as you go through the series. So yeah, the Tighten and Lift, obviously you can use that one every day. Retinol, you know, you can use a few times a week, but then you do have to stop it before the microneedling a few days before. And then as far as supplements, like or nutrients, I should say, two big things I see. The skin needs both fatty acids and calcium in order to look nice, not be dry, not be thin. So really getting fatty acids either from your diet, like fish, fish primarily, or taking a fish oil, and then getting adequate amounts of calcium too, again, from your diet, or you can supplement with it.
Diet is huge. If you're not already a back sleeper, try to be by the time
So
you hit
hard.
menopause. Yeah. It's going to be so much better for fine lines and wrinkles and facial symmetry. But yes, it's definitely hard. Invest in a satin pillowcase. Satin's not as much as silk, so they are pretty affordable. That will also help. You're so welcome, Ronelle. Thank you for attending and hanging around. Thank you everyone who's participated today. This video will stay up. It will be on YouTube, Facebook, and LinkedIn. I highly suggest following Cleo if you're not already. Again, her tag is, or her handle is at Dr. Cleo Amelia on Instagram. And she'll be around for more content. Yeah.
And if you ever have any questions, you can always message me on Instagram. I also do telehealth as well. So if anybody ever wanted to, doesn't live in California or Palm Desert, I always do telehealth. So that's always an option. And again, yeah, this isn't meant to be like medical advice. I just want to give you guys a good background of all the different possibilities of why hot flashes could be happening. And there's not always just one answer or one solution.
Thank you. Yes, you don't have to try to figure things out on your own or guess. And, you don't want to drop money on a bunch of over-the-counter supplements that may not necessarily be best for you. So this is all amazing advice. And I didn't know about your telehealth, so that's great.
Yeah.
Well, thank you, everyone. Thank you, Dr. Cleo. I hope everyone has a great Friday and weekend. And we'll see you around. Bye.